Hi, I'm Dr. Steve Weiner from the Aesthetic Clinique, and we're located in Santa Rosa Beach, Florida, between Destin and Panama City. And I'm a facial plastic surgeon that was trained at the Johns Hopkins Hospital in Baltimore. And what I'm going to demonstrate today is cannula use to fill the tear troughs and around the eye with Restylane. And I've been using cannulas for over 2 years now, and they have dramatically changed the way filler is done in this area. There is no longer bruising, or very little bruising if there is, and the downtime and swelling is hardly any. And you could basically go from here out to lunch and not have to worry. So what she has is she has a little bit of loss of volume around the eye and in the tear trough area. She's very volumized throughout her whole face because she's had Sculptra done, and it's been over 2 years since she had Sculptra, and she's maintaining her volume. That goes to show you how well Sculptra does. The problem with Sculptra is that you can't do it really close to the eye, and there you do Restylane. And Restylane is my favorite to use in this area. So what we do at the Aesthetic Clinique is we use a cold device here, which cools the skin. So it numbs the skin, cools it down, and helps with the bruising because it contracts the vessels. I'm going to start here. I make a little pilot, and this is the only needle I use. And blunt cannulas have a tip that it's not sharp, and it's flexible. And I bring it all the way into the corner of the eye here where she has lots of volume, and she doesn't even feel this. So there I go. I've done the 1/2, and did you hardly even feel that?
I felt nothing.
Right. And although I didn't do it in this injection, I can go all the way up here. The other thing we ask you to do is not take anything that thins the blood before we do this, because that will decrease the bruising as well. And so here I go. I'm just taking this up to the corner of the eye here where the tear trough is. I learned this procedure from a French physician, and most of our innovations do come from Europe. And I've been using cannulas almost exclusively for my filler since then, about 2 years ago. I'm done now with the procedure. So this is called a flexible blunt cannula. See, it's mobile. And the tip has no point to it, so I can touch it. And there's a little side port right there where the Restylane comes out. This is a 27 gauge. Gauge has to do with the thickness of the cannula, but that's very small. And I put 1 cc up here. You see she has absolutely no bruising, minimal swelling, and she's ready to go off to have lunch and have martini. So if you have any questions and you want to have a consult, please give us a call at 850-622-1214 or visit our website at theclinique.net.